Many people believe that passing away in old age is simply part of life's natural cycle. But did you know that most deaths after the age of 75 can be traced back to just a few common causes? Even more importantly, many of these causes are preventable. The truth is, aging doesn't have to mean suffering, weakness, or losing your independence. It's not just about how long you live, but how well you live. The key to staying strong, active, and independent for as long as possible lies in understanding these risks early and making small but meaningful changes. Many people don't realize something is wrong with their health until the damage is already done. Often, by the time serious symptoms appear, the body has already been struggling for years. But by becoming aware of these risks now, you can take control of your health, reduce your chances of serious illness, and enjoy many more years of energy, freedom, and vitality. Let's take a deep look into the 5 biggest threats to health after 75, and more importantly, what you can do to protect yourself. Heart disease is the #1 cause of death among people over 75. While many people associate heart attacks or strokes with sudden events, heart disease actually develops slowly over decades. It is often called the silent killer because the damage builds up quietly without obvious symptoms, until a major event like a heart attack or stroke occurs. By the time many people realize they have heart disease, significant harm has already been done. The heart is a powerful muscle, but like any muscle, it requires proper care to function at its best. Years of unhealthy eating, lack of exercise, stress, and smoking can take a serious toll, weakening the arteries and reducing the heart's ability to pump blood efficiently. High blood pressure, hypertension, is one of the most dangerous aspects of heart disease because it strains the heart and arteries, often without causing noticeable symptoms. Many seniors have high blood pressure and don't even know it, which is why regular checkups are crucial. One of the biggest misconceptions about heart disease is that it's entirely genetic or inevitable with age. While genetics can play a role, lifestyle choices have an enormous impact. Eating a diet rich in vegetables, fruits, whole grains, and healthy fats, such as those from fish and nuts, can help keep your heart strong. Avoiding processed foods, excessive salt, and sugary drinks can reduce strain on your cardiovascular system. Regular movement, even simple activities like walking, stretching, or gentle yoga, helps keep the heart healthy. Another overlooked factor is emotional health. Chronic stress, loneliness, and depression can contribute to heart disease by increasing inflammation and raising blood pressure. Staying socially active, engaging in hobbies, and practicing relaxation techniques such as deep breathing or meditation can make a significant difference. Prevention tips. Monitor your blood pressure and cholesterol regularly. Eat a heart-healthy diet with plenty of fresh foods. Stay physically active, even with simple exercises. Avoid smoking and limit alcohol consumption. Manage stress through relaxation and social activities. Aging brings changes to balance, coordination, and muscle strength, making falls one of the most dangerous risks for seniors. While a fall may seem like a minor incident for a younger person, it can be life-altering or even fatal for someone over 75. Falls are one of the leading causes of injuries and deaths in older adults, often resulting in fractures, head injuries, or long hospital stays that weaken the body further. Many seniors don't realize how much their risk of falling increases with age. Over time, muscles weaken, reflexes slow, and vision changes. Conditions like arthritis, diabetes, and even some medications can affect balance and coordination. The problem is that once someone falls, they often become afraid of falling again, leading them to move less. However, less movement actually increases the risk of falling in the future because muscles become even weaker. One of the biggest fall risks is the home environment. Loose rugs, poor lighting, cluttered walkways, and slippery floors can create unnecessary dangers. Taking simple steps, such as installing handrails, adding non-slip mats, and improving lighting, can greatly reduce the chances of falling. Wearing supportive shoes and using assistive devices when necessary can also help maintain stability. Prevention tips. Strengthen muscles with regular physical activity. Improve balance through exercises like Tai Chi or gentle stretching. Make your home safer by removing tripping hazards. Use assistive devices if needed, such as walkers or grab bars. Have your vision and hearing checked regularly. Lung health is often overlooked, but breathing problems become more common with age. Chronic obstructive pulmonary disease, COPD, pneumonia, and other lung conditions can quietly weaken the respiratory system, making everyday activities harder and reducing overall quality of life. Many people assume shortness of breath or a persistent cough is just a normal part of aging, but these symptoms may indicate serious underlying conditions. COPD, which includes emphysema and chronic bronchitis, is a progressive disease that slowly damages the lungs, making breathing increasingly difficult. Smoking is the leading cause, but long-term exposure to air pollution, dust, or chemicals can also contribute. Even for those who have never smoked, lung infections like pneumonia can become dangerous in old age. Seniors are more vulnerable to severe respiratory infections because their immune systems are weaker. Prevention. Tips: stay physically active to keep lungs strong. Avoid smoking and secondhand smoke. Keep indoor air clean with good ventilation and air purifiers. Get flu and pneumonia vaccines to reduce infection risks. Recognize early signs of lung disease and seek medical help. A stroke happens when blood flow to the brain is interrupted, either by a clot or a ruptured blood vessel. The result can be devastating, leading to paralysis, speech difficulties, memory loss, or even death. Stroke is a leading cause of disability in older adults, yet many cases are preventable with proper lifestyle choices. High blood pressure is the biggest risk factor for strokes. Unfortunately, like heart disease, high blood pressure often has no symptoms. Another major risk is an irregular heartbeat, atrial fibrillation, which can lead to blood clots forming in the heart and traveling to the brain. Managing these risks through diet, exercise, and medications can significantly lower the chances of having a stroke. Prevention. Tips: monitor and control blood pressure. Eat a diet rich in whole foods and healthy fats. Recognize stroke warning signs: fast, face drooping, arm weakness, speech difficulty. Time to call 911. Stay physically active and maintain a healthy weight. Memory loss and cognitive decline are among the most feared aspects of aging. Alzheimer's disease and dementia rob people of their independence, making daily activities difficult and increasing the risk of accidents and health complications. However, while some cognitive decline is natural, serious memory loss is not an inevitable part of aging. The brain needs exercise just like the body. Engaging in mental activities, such as reading, solving puzzles, learning new skills, or socializing, helps keep the mind sharp. Diet and physical activity also play a huge role in brain health. Foods rich in antioxidants, like berries and leafy greens, can protect brain cells, while regular movement increases blood flow to the brain. Prevention tips: keep the mind active with puzzles, reading, and learning. Maintain strong social connections to reduce isolation. Eat brain-healthy foods like nuts, fish, and vegetables. Stay physically active to support brain function. Many people believe that aging means losing control over their health. But the truth is, you have more power than you realize. While we cannot stop time, the choices we make every day shape how we age. Imagine two people in their late 70s. One stays active, eats fresh foods, and keeps their mind engaged, while the other spends most of the day sitting, eating processed foods, and isolating themselves. The first person is more likely to remain independent, avoid serious illness, and enjoy life, while the second may struggle with mobility, memory loss, and frequent doctor visits. The difference comes down to daily habits. Take heart disease, for example. Many people assume it's just a part of getting older, but simple lifestyle changes can make a huge impact. A 76-year-old man who starts walking for 20 minutes a day, replaces fried foods with grilled options, and drinks more water instead of soda can significantly lower his risk of a heart attack. His heart gets stronger, his blood pressure improves, and he feels more energetic. On the other hand, someone who continues eating high-salt, high-fat foods and avoids exercise may experience chest pain, shortness of breath, or even a sudden heart attack. The difference? Small, consistent choices. Falls are another example. Picture a woman in her 80s who decides to add balance exercises to her daily routine and installs handrails in her bathroom. When she stumbles one day, she catches herself and avoids injury. Now imagine another woman the same age who ignores her weakening legs, avoids exercise, and has a cluttered home. One day, she slips on a loose rug and breaks her hip, leading to months in a hospital bed. A simple home adjustment and some daily movement could have prevented it. Even cognitive decline is not always unavoidable. A man in his late 70s who stays socially active, plays chess with his grandson, and reads daily is keeping his brain sharp. In contrast, another man the same age who watches TV all day, rarely interacts with others, and avoids learning new things may find himself struggling to remember names or follow conversations. The brain, like a muscle, needs exercise. Use it or lose it. Aging well isn't just about avoiding disease. It's about maintaining independence, strength, and clarity for as long as possible. Imagine waking up each morning with the energy to go for a walk, prepare your own meals, and spend time with loved ones. Now imagine struggling to get out of bed, relying on others for basic tasks, and feeling trapped by poor health. The difference is in the choices you make today. The best part? It's never too late to start. Even small improvements, like adding one serving of vegetables to your meals, taking a short daily walk, drinking more water, or calling a friend instead of sitting alone, can add years of health and happiness to your life. You are not powerless. Your future is in your hands. Take care of yourself now, and your body and mind will thank you for years to come.